My name is Jobin Ball, and welcome to my presentation on how short anterior-posterior distance may predict conversion to sternotomy in minimally invasive cardiac surgery through a right mini-thoracotomy. This work has been done under the support and supervision of Dr. Jugan and Dr. Cook at the University of British Columbia in Canada. Minimally invasive or MIS approaches have become increasingly common for cardiac surgery. A retrospective review of MIS mitral valve surgeries has shown very low rates of conversion to complete sternotomy, with the conversions mostly being for major bleeding, severe pulmonary adhesions, or aortic dissection. Small body habitus, in particular a short anterior to posterior or AP distance, may be a risk factor for difficult access to mitral valve when done through a right mini-thoracotomy incision. However, this has not been previously studied. We performed a retrospective chart review of minimally invasive right mini-thoracotomy procedures that took place at Vancouver General Hospital from March 2015 to May of 2019. 86 of these patients had preoperative chest CTs and were included in our analysis. 5 patients were converted to sternotomy, and those were compared to the group that was not converted. The CT scans were evaluated for the AP distance, and this was measured at the level of the mitral valve. This will be illustrated in the figure that is to follow in this presentation. 2 sample t-tests were used to compare the means of the measures between the groups, and 2-tailed p-values were reported. In addition, f-tests were used to compare the variances between the groups. For our results, we found that the average age did not differ between the groups, and that the AP distance on CT chest was in fact significantly smaller in the group of patients who were converted to a full sternotomy procedure, with the group that was converted having an average AP distance of 9.71 centimeters compared to an AP distance of 12.18 centimeters in the group that was not converted. There were no perioperative deaths or wound infections. 1 patient had a postoperative CVA related to atrial fibrillation with no residual neurological deficit. Of the patients who were converted to sternotomy, 1 required mitral valve replacement instead of repair. Figure 1 illustrates an example of the CT scan used to measure the AP dimension. Shown are some of the structures, including the sternum and vertebral body, that are used to make the calculation for the AP dimension as shown with the double-headed arrow. All these calculations for the AP dimension are performed at the level where the mitral valve is the widest in the CT scan. In conclusion, we observed that a shorter AP distance on CT chest was associated with the need to convert to a sternotomy in patients undergoing the right mini-thoracotomy cardiac surgeries. Based on our observations, patients with an AP distance of 8 centimeters or less are no longer offered a minimally invasive approach because of the high likelihood of conversion to sternotomy. Here are the references for this presentation, and here I've included a poster summarizing our findings and this presentation. Thank you.